Okay, I think that you can see my first slide. Uh, First of all, a very good morning, everybody, and Assalamu alaikum. I would like to, first of all, wish you a very happy Ramadan to all my Muslim fraternity and my all friends around India and world. And I hope that everybody of you are doing well. And first of all, let me congratulate HCAP team, Dr. Mudgil, all the scientific panel, Dr. Senthil's support, and everybody who is part of this unique Youth Webicon 2020. And it's an honor for me and a great privilege to be part of this unique event. And I once again thank you all for inviting me and making me a part of this event. So as you can see on your screen, this is something which is my area of interest. I've been working so long, and all we physical therapists, we basically work on the pain management. Today I'm going to talk on evidence-based practice in effectiveness of pain education and exercises in chronic pain management. Now, first of all, you should understand what is pain. As per the International Association of Study for Pain, they say that pain is an emotional experience rather than a tissue injury. What does it mean? It means that you can get pain. There are multi-dimensional factors affecting pain. It is not only a single factor which is causing pain. So as per ISP, you can understand that they say that it is an emotional experience rather than only just a tissue injury. That is the definition of pain as per ISP. Then moving forward, you should understand there is something very important you should understand, that is pain sciences, basics of pain. For example, if somebody is getting hit on a thumb with a hammer, one's thumb hurts, right? But such experiences are understood easily with a structural pathology model, that a tissue was injured or you got a hit on your thumb and which caused pain. Now, to provide an accurate indication of the state of tissues, there are very important 4 key factors, and this is a paper. This is I am sharing you a reference from a very unique and very important paper of Professor Mosley, which showed us that there are 4 factors when you are talking about understanding of pain sciences. That number 1, that pain does not provide a measure of state of tissues. We don't know what state are they in when they get injured or when they are in pain, because it is a kind of subjective experience and we cannot objective measure it. Second point is that pain is modulated by many factors from across somatic, psychological and social domains. Before, as you all might be aware of, that we had different models of pain. We had Bayesian model, we had a biological model of pain where we thought that if there is injury to tissue, it can cause pain. But later on, it was told that no, we have different domains of pain. So you have to understand pain in a broader perspective. And when you're talking about chronic pain management, so they say that it has to be somatic, psychological, and social domains have to be taken into consideration when you are discussing pain. Third point is that the relationship between the pain and the state of tissues, it becomes less predictable as pain persists. What does it mean? It means that when the pain is getting chronic, you don't know what is happening with the pain parameters and the state of tissues. Are they healing well? Are they not healing well? How is the state of mind of patient? How is the social domain? So there are many factors when you are dealing with the pain sciences. The fourth point is that the pain can be conceptualized as a conscious correlate of the implicit perception that tissues are in danger. Sometimes patient can think that my tissues are in danger, so he will try to you be hyper vigilant, he'll be try to be conscious, so we don't know what is happening exactly at the tissue level. So when you have to understand the pain, you have to keep in mind that all these four factors are very important when you're dealing with the chronic state of pain. Now, this is very important. This I teach to my all students, and when I take talks, this is something called as body and brain. As you all aware of that, our body parts, they represent, they have representation in the brain, which we have the brain mapping system. Now, our body neurons in the motor cortex, they are grouped by body parts, and together the various parts of form a full representative map of your body. It is called as homunculus, right? If there is anything wrong with the homunculus, then patient can perceive pain, and it is, you can see that different varieties of pain. You can see that patient whether he is having there are various, I'll show you later in the later slides that what is the pain called as. Now, if the intact body schema in the sensory motor cortex, if you have an intact homunculus, intact sensory motor, the schema, body schema in the sensory motor cortex, then it is, you can perceive pain nicely. It is called as S1 representation. Understood? Now, if there is something wrong in the central pain processing, for example, brain is not able to understand that why he's getting pain, what is wrong with the perception of pain. So there can be abnormal central pain processing rather than the injury to the anatomical area. So this has proved to us scientifically and researchally that if it is not necessary that you should have an injured area to process pain. No, there can be different domain. As I told you, there is a biopsychosocial element of pain. So if there is central sensitization, there is abnormal processing of this pain, and that can cause a pain in the patient, whether they are suffering from chronic pain. So now there is something called as cortical smudging. If this central if the abnormal processing gets disturbed, if the normal processing gets disturbed when you're talking about pain, it is called as cortical smudging. Cortical smudging, if it gets disturbed, the brain becomes out of focus. So there is a little pain, but brain perceives it as a huge pain or more intensity of pain. So you have to understand that pain does not only depend on tissue injuries, it has a multi-dimensional aspects when you're talking about pain perception. So this is regarding the homunculus, the representation and central sensitization. Now, chronic pain can be divided mainly for three types. One is nociceptive pain, second is a neuropathic pain, and third is central sensitization. Now, depending on the source of nociception or the role of brain matrix, pain can be nociceptive. That is the first part of pain. In second, that is called as neuropathic pain. It will explain us the science behind pain neuroscience, underlining neuropathic pain mechanisms. What is the neuropathic pain mechanisms when you are dealing with neuropathic kind of pain? And central sensitization, it will explain you about the neuroscience underlining central sensitization of pain. That's very important. When I told you that if the brain becomes out of focus, so there is a wrong perception of pain perception, and the pain brain perceives it is in a wrong signal, and it can show that, for example, you might have heard about phantom limb pain. What is phantom limb pain? It is abnormal processing because there is no part. That area is, there is no part, and that's why that happens. That when you're talking about pain sciences, you have to understand that if there is an abnormal sensation of pain being perceived, that means there is something wrong with the cortical smudging. I'm sorry for the interruption. There is some technical interruption. It happens. So I'm sorry for this. It got disrupted. So okay. So I was talking about the I was talking about the pain sciences. Now, I will just regarding this. Yeah, there is something called as therapeutic neuroscience education on pain and disability. Now, when you are talking about this, it's very important to understand that therapeutic neuroscience education is a relatively new therapeutic intervention that aims to change the patient's perception of pain by providing them with a more accurate understanding of nature of pain. See, for example, what is this therapeutic TNE and PNE? This is very important because you have to understand that if patient comes to you with a pain, he is not coming only just with the biological aspect of pain. That sir, मुझे pain है tissues में, I feel pain while getting up and all. You have to understand all the aspects of whether he is psychologically depressed, whether he is having any other problems, whether he is having social problems, whether he is having problem at work, whether there are many factors of this one. That's what this TNE came to existence, and a lot of work has been done on TNE and PNE when they want to change the perception of pain. I will show you the research later on after this slide. Now, there is a research done by Professor Liu. He is a pioneer of pain sciences in America. They evaluated the evidence for the effectiveness of neuroscience education for pain, disability, anxiety, and stress in chronic musculoskeletal pain. And they concluded that study showed a compelling evidence that an educational strategy addressing neurophysiology and neurobiology can have a positive effect on pain, catastrophization, and physical performance disability. So you have to understand that if patient comes to you, you have to understand his psychological aspect, social aspect, and his biological aspect. So that is what this TNE came into existence. Now, he is Professor Liu, Adrian Liu. He is a PhD in pain sciences. What he tells that the more I learn about chronic pain, the more I realize that patients are desperate for help, and healthcare providers have so much to offer, but they don't even know it. This is what Professor Liu says, that we have a lot to offer to the patients when they come to us with pain, and patients are desperate for help, but we don't know what we should give because we are lacking in that kind of approach. So that's why we have to always follow biopsychosocial model of pain when you're talking about the chronic pain sciences. Now, there is a study which was done by Professor Liu in 2014. It was published, which I have shown before also to my students, and I showed them this is what is the importance of pain education. That you can see there is a graphical representation of how TNE can ease pain. You can see in this diagram the first row. It is a scan was performed. There was a high-level dancer in America. She was suffering with chronic low back pain, and they wanted to evaluate why she's getting this kind of pain. So they did an experiment on her in their pain science lab. What they did, you can see in the first row, in the row number 1, she was in the scanner, relaxing, watching a movie, and you will notice there are no red blobs, red spots. आप देख रहे हो कोई भी red spots इसमें नहीं है in the first row. You can see this? Yes. Now, in second row, what they did, she was asked to move her painful back while she was in scanner. वो स्कैनर में थी, उसे कहा गया कि अपनी पेनफुल बैक को आप आगे फॉरवर्ड बेंड करो. And what you can see in the second row, that the pain, there are so many of red blobs. It's showing that she is in a severe chronic pain. Low back pain उसको बहुत हो रहा है. She was in pain. Now, this is the second stage. In third stage, she was taken out of the scanner and she was given 20 to 25 minutes of pain education. She was given, and you can see there. You can see only hardly few red blobs are there in the third row. What happened? See, उसका back same है, उसका problem same है, उसने movement same किया, but everything has changed. What is this? Is it magic? No. This is what therapeutic neuroscience education can do. Because you have to tell him, patient को sir कोई problem नहीं है. If you bend your back, whether you have disc prolapse, कुछ नहीं होता sir, nothing is going to happen. If you are lifting something, if you have disc prolapse, nothing is going to happen. Sir, if you are getting pain while bending forwards or sideways or backwards, nothing is going to happen. So you have to understand, make them understand. So this is when you change their perception of pain, their mindset of pain, that can have very good effect when you are dealing with chronic pain. So आपने देखा in third row में only 25 minutes of pain education has changed her perception of pain. She was more relaxed and she could do the same activity with less pain. So this is what TNE can do. Now, talking about the Cochrane reviews, many people with low back pain, they become frequent users of healthcare services in their attempt to find treatment that minimizes the severity of their symptoms. आपने बहुत पहले देखा होगा that when you are talking about the back schools, they were a therapeutic program given to groups of people that includes both education and exercises, right? But for the outcome, pain outcome के लिए, we found very low quality evidence that back school is more effective than no treatment. That means if patient is not taking much of treatment, it is not going to help him. If you are only giving back school बहुत 10 साल पहले we used to use it कि belt बांधो, ज़्यादा मुंह नहीं करना, keep your back stiff, rigid and sit straight. तो अब वो साइंस खत्म हो चुका है because there is very low evidence. It says that if patient gets back pain, if you are using this kind of strategies and you are preventing the movement of spine, it can help. It cannot help now because हमको ऊपर वाला ने ऐसा बनाया हमारे बैक को that if you bend your back in all directions, it is not going to harm your body or your discs. For the outcome of disability, we found very low quality evidence that back school is more effective than no treatment. So for this back school, we always wanted to have some kind of meta-analysis and systematic reviews so that we understand which treatment protocol is effective when you're dealing with pain and chronic pain. For example, mainly for low back pain, I'll be talking. So I'll just, in this session, I'll just talk about low back pain. Now, there are some evidences. You can zoom in to this. If you can see this slide, this is the latest Pedro evidence we have for physiotherapy evidence, which is available to us now. And if it is not clear, I can share it with you later on when we are discussing about the pain. Now, if you can zoom your screens, you will see there is the first research. It was given by Nouri 2019. They did a systematic review. These are all systematic and meta-analysis which is done on low back pain. Now you can see they have shown that therapeutic ultrasound, if patient comes to you with low back pain, therapeutic ultrasound, there is a lack of evidence that it is effective in low back pain. Understood? So this is a systematic review done by Nouri 2019. They published the paper that ultrasound can have a kind of placebo effect or there is no direct effect, and there are lack of evidence for that. Second research, I'll go through very quickly. It is Lee 2019. They published a paper meta-analysis on kinesiotape. Now kinesiotape, there is also a lack of evidence that we can use chronic kinesiotape for chronic low back pain. There is no effect on pain intensity, yes, but in disability they found a decrease significant in oscillatory disability index. They found it, and that is the when they talk about kinesiotape. Now coming for the PNE, that is called as pain neuroscience education, they found it moderate quality evidence is available for pain education in adjunct to usual physiotherapy. For example, you're using exercises or using any other modalities. So they found it that if you're using pain PNE, it can have a good effect on pain, chronic pain. Now coming for TENS. Now many of us, even I was also using before, I didn't know about the PNE. We used to see that there is a lot of evidence is coming that we are using TENS. Patient आया, उसको अपने TENS लगाया, hot pack लगाया कि सर chronic pain है, दे दो. But TENS is not recommended at all to use in chronic low back pain. This is a study which was done by It was done by Rosende 2018. They published this paper that TENS is not effective in chronic low back pain. Same way, when you're talking about osteopathic intervention, it is not recommended due to lack of evidence. Understood? So this is regarding the some meta-analysis. Even massage also is not recommended to treat low back pain because there is no effect on pain and other parameters when you are talking about the chronic low back pain. Now I will share you some more evidences with you. Now there is a paper published by Rubinstein in 2019 about the spinal manipulative therapy. It is a meta-analysis they did. Now you can see there is a moderate evidence available that spinal manipulative therapy provides better results than other interventions. So exercises, PT back school, they are second. So this is the role of physiotherapy. If you perfectly know spinal manipulative therapy, we have moderate quality evidence that it can have a good effect when you are treating the low back pain, chronic low back pain. Now another is there is something called as CFT, cognitive behavioral therapy. There is mixed results that we are not sure that how it can alleviate pain because there was a decrease of pain in 5 of 10 studies. So and disability also is mixed. So we are not very much sure. So there are some papers. Now walking intervention, they say that walking is no more effective than staying at. If you don't do any treatment and you just walk, it is not going to help you. So I shared with you these all evidences to show you that when you are treating pain because of parameters, so you should understand that manipulative therapy, spinal manipulative therapy has a moderate quality evidence that it can have a good effect on low back pain. Now, recent advances in TNE, that is individuals with chronic musculoskeletal pain, also tend to have inappropriate pain cognitions associated with poor treatment outcomes such as kinesiophobia, hypervigilance, and pain catastrophizing. That is one more thing that you should understand. If a patient comes to you with kinesiophobia, because जैसे ही पेशेंट को डिस्प्लेप्स होता है उसको हम बोलते हैं कि सर आपको डिस्प्लेप्स हो चुका है L4, L5, L5S1, अब आपको मूव नहीं करना, स्टे, डोंट डू दिस मूवमेंट्स, अपने बैक को रेस्ट्रिक्ट करो. सो व्हाट हैपन्स, वो अपने टिश्यूज को, वो अपने कोर को करता है, टाइट करता है, एंड ही इज नॉट डूइंग एनी मूवमेंट्स. सो दैट कैन कॉज काइनेसियोफोबिया, fear of movements, and that has a very bad effect on your spine. Then they become hypervigilant. Hypervigilance क्या होता है कि they have fear that if I do this I'll get this, if I do this movement I will have more pain. तो उसको एक डर बैठ जाता है माइंड में and they become hypervigilant. And then there is something called as pain catastrophizing. If there is a slight pain, they will tell that no sir, on when you are assessing them subjectively, they will tell that we have हमें बहुत ज़्यादा पेन हो रहा है, but pain will be less. This is because of these two factors. When they are kinesiophobic, when they are hypervigilant, there can be pain catastrophizing. So when you are combining pain education with cognition targeted exercise therapy, it can have very good effect on patients who are having chronic pains. So there is one more therapy in advance. It is called as ACT therapy, acceptance and commitment therapy for chronic pain. I don't have time to explain that. In that, you patient will accept that what kind of pain he is suffering, and then he can have this kind of treatment done to them. And there is a study done by Mary Bird Casey in 2018. They showed that they are satisfied with intervention when they gave this combined pain education with cognition targeted exercise therapy. Now, this is one of our paper which will be coming very soon. Actually, we have heard that pain is multidimensional, but we were trying to find out that does pain have a religious and cultural beliefs? Have they overpowered pain? So There is one of my great friend, Dr. Surab Sharma. You all know him very well, and he's also part of our Haryana Chartered Assistant of Physiotherapy. He's a very great fellow dealing with spine pain and pain sciences. So we did a study together that is called as we wanted to understand that whether culture and religion can have any effect of pain. Now, you in the first picture you can see there's a Buddhist monk. It was a study was done at Dharmasthala, and there's a Buddhist monk, and we wanted to understand that why don't they get back pain or neck pain while sitting in a long this lotus posture for a long time. So when we assess their pain, we ask them that when you sit in this position for 12 hours, do you get pain? But we could understand that they don't have pain. Why? Because they have conditioned their body and brain in such a way that they don't feel this posture can be harmful to the body. And when you're giving the questionnaires, when you're assessing them, you don't see any kind of pain in that. Same way, one more study, the other part of study we are doing, these are our Shia Muslims. When they hit their body with the knives, and you can see a lot of blood comes out, they injure their tissue parts. But if you ask them, is there any pain? What they tell? Sir, pain nahi hota, hame pain nahi hota. Because it is imbibed in their body, in their mind, in their culture, they don't feel pain. So this again proves to us that tissue injury is not necessary when you are trying to perceive pain. It can be psychological and other aspects are there. So this is we want to understand the paper title is Associated Risk Factors for Low Back Pain and Neck Pain in Indian Buddhist Monks and Shia Muslims. Now, there are some programs which in America are very famous, that is called as chronic pain rehabilitation programs. They wanted to understand that if you want to treat chronic pain, what is the most important aspects of pain when you are dealing with chronic pain management? So they have designed a protocol in America, and it's very famous now. It is called as chronic pain rehab program. What they do in the first part, a patient comes to you, he is taken to pool therapy, that is just for relaxation and for basic before doing any exercises. It is kind of in a pool he will lie down, whether he is doing any activities, swimming or just relaxing in the water, so that he's relaxing there. In next part of this, they go for stretching and core strengthening exercises in the second component. In third stage, they go for mild to low impact aerobic exercises of spine or whole body. And in the fourth part, there is also a relaxation therapies, whether they are listening to music, whether they are sitting in the massage chair or whatever. It is up to the patients to relax and be calm. Then there is something called as coping skills training. Now, if you have seen this, I have also faced this difficulty in my before career. Many of us might have failed. We think that if we see someone doing better than us, for example, you're working in a hospital where you see the patients are they are getting a lot of good responses and for other therapists, and you're not up to that. So you think that no, my skills are not coping of skills, or sometimes you have this inbuilt that kind of anxiety or a depression kind of thing. So this therapy also helps you deal with the coping skills training. So that time they'll understand what is the problem which is causing this barrier. So that can be taken out with this coping skills training in this program. Then there is weekly individual psychotherapy. Psychotherapy is a very important aspect of chronic low back pain when you're dealing with this. Okay. Now, there is individualized non-narcotic therapy. Now, some patients who are taking narcotics, that is the highest pain medication available. There is a program, it is called as individualized tapering of narcotic pain medication. They will be, because if you take narcotics, patient get addicted. So it is very important for them to do de-addiction protocol so that they go from narcotic to non-narcotic management. That is very important. And last important aspect is, it is called as life work exposure therapy. In this, what happens? Okay, so I just want to share, because I just want to share you this one paper. It is a combination of 10 papers. You might have heard about this paper. This is called as this is called as it is a paper which is given by Professor Peter, and this deals with the back facts. You might have heard about this paper. So I would just want to, if many of you don't know about these facts, there's a paper they were published in this paper. It clearly showed us that how back pain, there are myths around back pain. Now, the first, I'll go very quickly in this for this paper. Professor Sullivan tells that they did studies, multi studies they did, then they made this paper. The first point in this paper is that it told us that persistent low back pain can be scary, but it is rarely dangerous. Now, getting older is not a cause of back pain. Third point in this, persistent low back pain is rarely associated with serious tissue damage. If you have chronic low back pain for a long time, it doesn't mean you have damaged your tissues a lot. Now, in the fourth point, scans rarely can show the cause of low back pain. They cannot show. Now, the fifth important point is that pain with exercise and movement does not mean that you are doing harm. If you get pain while doing exercises, it means that your tissues are sensitive to particular movement, so you have to do this movement in order to prevent the sensitization of tissues. So it is important for you that if patient comes with it, sir मुझे पेन हो रहा है जब मैं आगे बेंड करता हूँ, so उसको बोलना है कि सर it is okay, आपके tissues sensitive हैं, so you have to do exercises so that the sensitivity comes down and you can, because spine is very flexible, you cannot restrict its movements because nature has given us. Now, back pain is not caused by poor posture. How we sit, stand, take the load off, it does not cause back pain, because हमारा back इसीलिए बना है to take load, to walk, to carry something. So God has made it like that. So it cannot cause back pain. I don't have time to explain that. So it might be later on if we have some other session that we can tell. Now, seventh point is that back pain is not caused by weak core. Before we know that अगर आपका abdominals weak है तो you can get back pain. But now we are very much sure that this paper has shown, the studies have shown that back pain is not caused by weak core, because we have strong ligaments are there and body compensates for any kind of weakness, so it cannot cause any back pain. Now, the eighth point is that backs do not wear out with everyday loading and bending. See, अगर हम bend करते हैं, move करते हैं right sideways, anteriorly, posteriorly, it cannot cause any kind of back pain when you're dealing with the pain. Okay, now the next is pain flare-ups. If you have pain flare-up, it doesn't mean that you're damaging your back. Understood? And the last point is that injections, surgery, and strong drugs, they usually aren't cure. They cannot cure your low back pain. So this is about a paper which I want to share with you all. Back facts. You can see these are myths of low back pain. Then there is something called as cognitive functional therapy. It deals with multi-dimensional pain aspects. It deals with the person's pain experiences, cognitive functional therapy, and person's valued goals. So it can deal with different aspects for the person's factors, clinician factors. So you have to understand that these are all therapies which is available to treat chronic low back pain. Now, when you are giving this pain education for the patients, you can see pain decreases, the function can improve, fear diminishes, thoughts about pain are more positive, knowledge of pain increases, and movement improves, muscles work better, and patient spends less money on medical tests and treatment. The brain calms down as seen on the brain scans, and people are more willing to do much needed exercises. So these are the implications if you give a very good quality PNE and TNE education for the patients when you are dealing with chronic pain management. So these are all the outcomes which you can see. Automatically their pain will decrease, they will be functionally more better. So these are all things which can be helpful when you're dealing with the chronic pain management. So this is what is the take home message. Take home message is in both chronic and acute pain conditions. pain is still the brain's interpretation of physical danger. To reduce pain, we need to reduce the credible evidence of danger and increase credible evidence of safety. This is what Professor Mosley says, that if you want to decrease pain, you have to reduce the evidence of danger. कि सब इससे आपको pain होगा, इसे मत करो. If you tell them that no, nothing is going to happen, कुछ नहीं होता सर, आप आगे bend करो, exercise करो, but you have in chronic pains. So this is what is the take-home message. So I am very thankful to the organizers of Haryana Charter of Physiotherapy for giving me the opportunity to be a speaker in this youth webcon, and I thank you all once again for giving me this time to tell you something about pain education. So I hope that you will study more and learn about the theories of pain, the education cycle, what is the latest evidences we have available. As I told you that what is the available. So have your manual therapy nicely, and we can. So this is, yeah. So now I think I can just come. Yeah. So this is what I wanted to tell you regarding the pain education, and this is very important for you when you're dealing with the pain sciences, that you have to understand all the aspects of pain, whether it is biological aspect, psychosocial elements. And we are also doing papers, हम भी paper करते हैं, we are doing researches on, we have upcoming papers on, we are trying to understand the level of depression the patients get when they have chronic low back pain. So this is what we have been looking forward for this, and that is all I think from my side. If you have any kind of doubts, I'm sorry for the interruption we had in between. We had interruptions we had due to technical difficulties. I'm apologies on my behalf for this all. So you can ask me if anything is there which I can tell you. So I thank you once again for giving me this opportunity to have this talk with you all, esteemed, and you are a wonderful event this is, and we have all the elites of India and abroad working with us, and I think that is all from me on this session, and I hope to see you soon, and goodbye, take care, and anything you have to want to ask. So this is regarding the pain education. So yeah, yeah, there are, see, I have some questions from, I think, participants. They're asking me some questions, sir. What is, how can we see? For kinesiophobia, we have Tampa scale. We see, actually the pain, the problem is that when you are discussing the pain sciences, you have to nicely assess the implications of pain. See, now still today we don't have any tool to objectively measure pain. We have this one pain sciences, where we understand the subjective matters of pain, but when it is coming for the objective matters of pain, still there is no tool which can tell you exactly कि pain कितना हो रहा है और tissues का level क्या है. उसके लिए we are working on that, and we have to work in that so that we can understand that how can we evaluate pain. Okay, so that is, yeah, what are the most promising experimental treatments of chronic pain? See, I told you that TNE and PNE is very effective when you're talking about pain sciences, and they have now the chronic pain rehab programs in America. They have been very effective and in dealing with the chronic pain conditions, and they have been very effective. And I don't know in India whether we have started or not, but in here also we are trying to start that. So if patient is having any kind of phobias, exercise phobia, movement phobias, you have to make sure that patient को आपको educate करना पड़ेगा. You have to educate them that moving your back cannot cause any harm. Because देखो, I one example I'll show you. ये हमारा spine है, right? This is our spine, for example. Imagine. अब देखो, इसको आप ऐसे bend करो, side में करो, कुछ भी करो. Nothing is going to happen because God has made spine very flexible. Now hold your thumb and try to do this. Now it becomes difficult. Why? Because you are trying to hold your back. जब आपको God ने बनाया flexible, who are you to make it rigid? So movement is the key. You cannot stop movements. You have to do exercises that can help you recover back, and also avoid any kind of phobias and sensitivity of the back tissues. So I once again thank you all, and I wish you again a happy Ramadan, and keep studying, keep learning. Education is the important key, and we need that everybody should get quality education. And I hope that you had a good session, and thank you so much, and for the office, take care. Bye bye.